Officer O'Neill can attest to this. That is a resounding yes. We have definitely seen a spike in calls. What we do know for sure is that the number of crisis calls has increased significantly, with a noticeable spike starting in April of 2020. Not surprising. Really, it was about as the news of the pandemic became more widespread, more fear really set in and anxiety. We started receiving calls really almost outside of our normal scope of, what a typical call would be at 262 Help. So just to give you an idea, I'm just going to use some statistics, some numbers here. I apologize. But in 2019, 262 Help documented approximately 23,600 crisis calls. And it's been a slow and steady rise over the last, let's say, 10 years. So that was probably our highest number of calls in 1 year. And then when 2020, we got to 2020, the first 3 months were typical months. We documented about 7,000 calls. In the following 3 months, so starting in April, we documented almost 10,000 calls in that 3-month period. And then we began to see the momentum really shift, and just the call volume just really picked up. The trend continued through the remainder of 2020, and we documented 35,000 crisis calls in 2020, which was our most, the most calls we ever documented in any year that I've been here. We continue to experience the same high call volume, and we're actually projected for 2021 to almost hit 40,000 calls. So clearly there's a need, but the good thing is that people are calling. So that gives us hope that people at least know, at least one number to call, and then we try to kind of connect them to the appropriate, services from there. What's not so easy to determine is how many of those calls were in any way related to suicide or resulting in hospitalizations following a suicide attempt. That's really in the narrative of our calls, so it's kind of hard to tease out those details. I would suspect that there is definitely a rise, an increase in those, scenarios. We know that we received many calls from people who never really needed to call our line before. So we're answering calls for people who, just found our number for the first time, calling our number for the first time. A lot of the calls we received had to do with, people had a lot of questions about the virus that, of course, we didn't know those answers, expressing a lot of fear and confusion about what and who to believe. I can recall also there was a period of time where we were receiving calls from people who were actually acknowledging the need for like a higher level of care, but fear of contracting the virus was stronger than the discomfort they were actually experiencing due to their mental health symptoms. So that was a big problem, especially in the beginning of the pandemic, especially with us being, everybody's stay home, you can't go out, don't go to a hospital, offices are closing. So, that might have contributed to the sharp increase in calls that we were receiving, in addition to, just the overall panic that collectively people were feeling as a community. So, everybody on this call could agree, I'm sure would agree that, as mental health providers, we know that untreated mental health symptoms can very quickly worsen if they're not treated. And under such circumstances as a global pandemic, I don't think we're surprised that people are not coping well, and need to ask for help, and in some cases for the very first time.